Evening. Welcome everyone. I'll just wait for a few people to get joining before we get started. I think the connection is just going through now, so hopefully people will start to see us going live, which is good. And let me just mute that as well, actually. Be a good start. Okay, so this evening's Instagram Live. Hi, my name is Chloe, and I'm your social media coordinator here at Care. So tonight's event is egg donation with Care. So how to become an egg donor, and I'm going to be joined by my lovely colleagues Emily and Julie in just a couple of minutes. So we'll probably be on for about half an hour, give or take, depending on how many questions we get coming in. But we're going to talk through how to apply to become an egg donor, what you need to know, the important stuff, what the journey's like and what's involved, and then we'll answer your questions towards the end. So yeah, probably about half an hour. So I'm just going to start to invite them on now. Hopefully it won't take me too long, and they'll invites. But yeah, please send any messages in at the bottom and I'll do my best to catch all your questions. Hello.
Hi.
There we go. I was really nervous doing that intro. It's so much easier when you've got else on with you. I was like, I feel like I'm talking to myself. And here's Em as well. Hello.
Hello.
Here we go. So what we'll do is, if you guys want to introduce yourselves briefly, and then we'll get started, I guess.
So I'm Julie. I'm one of the donation nurses. I'm based in our Manchester clinic. I've been with Care for over 2 years now. So I get to work with all our lovely donors and all our recipients, everything donation, really. Lovely job. Love it.
Lovely. I'm Emily. I joined Care last May. I work remotely, but kind of centrally, so I do different clinics, mainly Leeds and Nottingham. So again, I get to work with lovely donors and recips, everything through a donation as well.
Oh, that's really good. It's a nice rewarding job, isn't it, working for Care?
Definitely.
Especially on the donation side too. So if anyone has ever been in touch on our social media channels, it's probably me that you've spoken to as well. So it's nice to put a little bit of a face to a name. Or if anyone messages after the live and you've got any questions, you'll probably come through to me. So feel free. And also you can call our donation team from 9 a.m. tomorrow. Or you can submit a donation form if you feel ready to get started. You can just go straight on the website, can't you guys? So yeah, what we'll do is we'll get started, I think. And Julie, you've got a nice little message to start with, haven't you?
Just a massive thank you. So basically anyone who's ever donated in the past, who's coming through to donate with us, who's got a collection coming up anytime soon, or anyone that's filled in the forms or is considering donation, just a massive thank you, because it's an amazing thing to come and do. I think it's such a privilege to be able to do this job. I'm sure, Emily, you agree. We get to meet the most amazing people. It's a lovely, selfless thing to do. And our recipients that come through that need to use donor eggs can never really thank our donors themselves. So we always just like to do it numerous times throughout the journey. But so I just wanted to tonight say thank you to everybody that has and is coming through too. So yeah,
wonderful. And then I think, Emily, you're going to go through a little bit of how to start with a donation journey.
Yeah, so it's dead simple. Easiest way to donate is to register on our website, so the Care's website. You'll then be sent some forms to complete. Once you've completed all those forms, they will be reviewed. We sometimes might ask a few more questions based on what you put on the forms if we need any extra information. We do have a dedicated team of nurses, midwives, consultants, administrators that look after all our donors. So there's a dedicated team for you. And just to note, really, there is a selection of clinics across the UK to choose from. So there will be one kind of closer to you. And kind of if you live in the middle, you've got a bit more choice. You kind of choose whichever one you prefer, which one suits you best as well. Julie, I know you wanted to go in a little bit more information with the criteria.
Yeah, just when you are filling in the forms, there's criteria initially. So your BMI has to be under 35. You do have to be between the age of 18 and 35, not really kind of 6 months past your 35th birthday, really. Other things just to consider, you know, you can't be an egg donor whilst you're pregnant and whilst you're breastfeeding. Most contraception is fine, but, you know, if you do have the depot injection, you would need to have kind of come off that and periods commenced again before. So there is some criteria there that you have to meet. We do review forms on an individual basis, so we're not going to sit here tonight and say, well, you wouldn't be accepted for this, or, you know, all forms are reviewed individually. But all I would just say is just be as informative as you can on those forms. Give us as much information as possible. We do review them, and we may need to ask you some questions, as Emily said, and then we'll pass those on to our consultant, who has kind of the final say so. So it can take about 2 weeks really from you filling those forms in, us reviewing them, asking any questions we might need. But as I said, just be as informative as possible if you can be.
Yeah, it's because we kind of, well, we treat all donors as individuals just as we do our patients as well. So all your protocol's really personalised, isn't it, in terms of what dosage you have for your injections, when you're going to do it, how long you're going to do that for. And obviously I know we'll go into a little bit more detail about the full journey as we go through anyway. And I was just going to remind people again to keep your questions coming in. I am making a note of them. We'll cover them at the end. So don't think if we're not talking about them right now that we're not going to, because we will. I'm writing them down. So yeah, just keep them coming in. And then, so I think we're going to go on to what kind of happens, I think, at first appointment. Is that right, Em?
Yeah, so in terms of next steps, once you've done the forms, you'll have a first appointment with a donation nurse or donation midwife. It doesn't matter, we all do the same thing. That will be via telephone appointment. The first call really is to discuss the implications of donating, discuss the journey with you, just make sure you fully understand, you're happy with it. At that call, we might clarify some details for you on your forms you filled in, we record your characteristics, and obviously arrange your next appointment from there if you want to continue. So the next appointment after your telephone call, that will be in your chosen clinic. That'll be for a blood test and scan. We'll also check your height, weight, blood pressure as well at that appointment. So with the blood test, look at your AMH, that's just your anti-malarian hormone. That kind of gives us the idea of the number of eggs in your body. And then you'll also have a vaginal ultrasound scan at that appointment as well. We want to make sure you've got 2 ovaries, we can safely get to them. And then with that scan, with what they're doing is the ovaries, that's where your follicles are, those little fluid-filled sacs where your eggs develop. So what they'll do with the ultrasound is count the number of follicles, and then that number, coupled with your blood test result, tells you, yeah, you meet the criteria, you can come through and donate, because there is a certain criteria we need. It is really informative, the scan as well. The sonographers, they're brilliant at explaining it. So most donors always say they find it really interesting to kind of go to that appointment as well. Yeah, any questions with kind of that second bit, or is that all right?
Amazing. I had a thought come in actually as you were talking about that. A kind of a benefit to donating actually is you do kind of, it's you find out your fertility level as well, don't you? Really nice.
Do.
And then if we do sort of, if it's quite rare, but if we do find anything, we can always inform you then, and then you can make your choices going forward. So yeah, it's a really nice way to kind of learn a bit more about your body, but you're obviously doing a really nice thing as well at the same time. So, and yeah. Scans are really interesting. Like, it's just amazing because you think, oh my god, is that what it looks like? And are really cool. And they let green as they're doing it, so they make you really comfortable as well. They're really, really cool. So I think we're going to go into how many appointments would somebody actually attend along the journey? Actually, I'm going to ask that one now, just as we were talking about that.
Yeah, no, I'll continue on the pathway if you want, kind of explain. So what, after you've had your blood test and your scanning clinic, you'll have another appointment with, again, donation nurse or midwife. It is usually the same person you would have spoken to at your first appointments. It is really nice to have that continuity, speak to that same person again. That usually takes place over Microsoft Teams. I know, Julie, you sometimes have your donors in Manchester, so it does vary, but you know, you will try and see that same person again. Now, at the second appointment, we go through kind of the process again with you, the implications. We do appreciate it's so much information to take on at that first appointment, so we kind of highlight some important bits with you again. We'll go through some consent forms with you, kind of explain them all to you, make sure you're happy filling them out at home, and again, we're always on hand if you have any questions as well. And then we also kind of discuss with you again, you know, when's convenient for you to have treatment. We do appreciate, you know, you're busy people, you might have holidays and things coming up, so we can kind of schedule treatment around kind of certain months just so it suits you as well, because obviously you're doing this kind of amazing thing, so we want it to work for you. Yeah, that's good. And what's been good is we have reduced the number of appointments that you actually go into clinic for, haven't you? So really reduced, yeah, definitely.
Counselling's available all the way throughout. You can request more appointments if you feel like you need it. We do offer it as standard anyway, but we try and then make that nice and convenient for you, so we can do them virtually as well, rather than travelling into clinic if you don't want to. So yeah, that's one way that we've improved the pathway, which makes it really, really good for donors. So yeah, that's really good. And then I think we're going to move on to the implications of donation.
Yeah, so this is just to talk about kind of a bit separate from the medical kind of procedures. So yes, whilst donating your eggs is a medical procedure, you'll have blood tests, you'll have scans, the actual egg collection. The actual implication to you as a donor can potentially have lifelong implications, because you may go on to, children may be created through your very kind donation. So the main implications for you as a donor is that there's no anonymity any longer. So any child that is conceived through donation can actually, at the age of 18, legally find out who their donor is.
Yeah.
And what they can find out about you is your name, your last known address, your place of birth, and your date of birth.
Yeah.
So that's that we always tell our donors.
Yeah, sorry, I was just going to quickly interject then, sorry. This year has actually been the first year that can happen since the law changed in 2005, wasn't it? So any child born that's turning 18 this year can actually then apply for that information. So it's quite a significant year this year.
Not yet, because I think it's going to be towards the end of the year. But yeah, it's just, we always let obviously our donors know, and some will say, oh, is there an opt-in and opt-out? There isn't. Legally, that is the right of the donor. So it's just for you to be mindful of that. And you know, again, we don't have a crystal ball, so nobody knows if that person, as they're growing up, is going to want that information. But for you to know that they're entitled to it, they might want it. If they do want it, they may want to try and make contact. They may not. Who knows how social media is going to develop in the next 18 years. So that's just one of the main implications of donating.
Yeah.
The other one to consider is what we call the 10 family limit. So you as a donor, you can only ever help to create a maximum of 10 families. Doesn't necessarily mean 10 children, because there may be more than one child born in that one family. But it's 10 families. But you can restrict that number. I have seen some people that are comfortable with 6 families, 8 families. The maximum is 10, and we would never exceed that. That's something that we always keep on top of. People often ask me, well, how many times can I donate? They want to come and do it multiple times. We have lots of donors, which is wonderful, who come back and do it multiple times, and that's something that we'll always keep an eye on as well.
Yeah, brilliant. And have you got any more on that? Sorry, Jude.
No, I was just going to say, on the flip side, because obviously the law is quite stringent, but you as a donor, should you want to find out if your donation has been successful, then you have that right as well. You can report, and what we can say is yes or no, and if it's a yes, we can say baby boy, baby girl, and year of birth, but that's all we can say. Some people want to know because they want to know that what they've done has actually worked for somebody, and for other people they don't want to know, just the act of donating is enough for them.
It is really nice, and I think we can touch upon a little bit of that kind of side of things. Like, recipients are always just so grateful for what they receive, aren't they? And they sometimes write letters of thanks that we can read out to our donors and things like that, and that's happened in the past. So yeah, it's a lovely, honestly, thing to do. And if sometimes I feel like some donors don't ever sometimes understand the impact, even though we say it a lot, and we always try and make sure that sometimes I don't think they realise the impact of what they're actually doing until maybe a little bit later. But it is an incredible thing to do. Good. So I think we're going to go on to when you are ready for treatment then, I think.
Yeah, so just following on, obviously you've got the counselling if you'd like to have it, it's completely up to you, and then after that you'll have another blood test. So we want to make sure you're not a carrier of anything which could potentially be passed on, so we'll do some genetic screening, we'll do your karyotype, and then we'll also do some sexually transmitted diseases as well. Just to summarise all those appointments for you, because again it is a lot of information we give you on the call. You've got the initial telephone call with membrane donation, your clinic appointment for your blood test and your scan. Another appointment with a membrane donation can be kind of virtually, remotely, if that suits you better. And obviously, if you don't want your counselling, or you can have your counselling, then you've got that final appointment in clinic for that blood test as well. So that's kind of the process of appointments to get you ready for treatment. Timeframes, it can vary. Julie, you probably agree with that, to be honest. It can be, 3 months from filling in the forms. If you're quite available for appointments, it can take a bit longer. That kind of really also varies kind of from your availability and donors' availability for appointments as well.
Yeah.
Now, and that's it. It just, I'm sure you kind of heard that as well. Yeah.
Yeah, I was going to say, and it can depend on how many applications we receive, because sometimes if we've got absolutely loads, it might just take a little bit longer to get through your forms and stuff and then invite you in. But yeah, it's generally
we'll say 3 months is a ballpark, but it can be a bit longer. Again, it just varies.
Yeah, and you are guided and prompted every step of the way. Sometimes you can see people's eyes like, I can't take in information, but we're there. Emails, phones, appointments, just to reiterate that the things that you've got to do.
Yeah, and the patient portal is really good. We send all your forms to a secure portal that you can log into. So if there's anything outstanding, it kind of gives you alerts, and you can see what you need to do, or if you've had anything from us, and then we can see at our end as well. So we can give you prompts as well, just to go, just need to fill that out, etc. And then you'll be done. But yeah, you can always contact us. You can always ring us. You can always get in touch on socials as well, and then we can support you at every point. So I would say sort of, if I'm then starting on my first injection, then kind of what's the timeline, appointment, etc.
Yeah, so what will happen, obviously, you've had your appointments, you complete all your consent forms, you're happy. We'll look at getting you actually set up for the treatment process. So we'll discuss with you again, when's convenient for you in case anything's changed for you. So again, once everything's completed, we'll complete a prescription for you. We'll get some medication sent to you. And then we complete something called a treatment plan or a protocol. So you might hear these words a little bit. That's just essentially a step-by-step guide of what to do and when. So it's dead straightforward for you. Basically, just to summarise, day one of your period, that'll be the starting point. You'll start some medication the next day. The medication, it will be injections. You've got to be happy to give yourself those injections, but we'll explain it clearly to you. We make sure you're happy with how to do it. I'm always more than happy to do another call with donors, kind of to explain it once you've received your medication. I'm sure you are as well, Julie. We do also have some amazing videos. We call them injection teach videos, and we do send them to everyone. And I always say to donors, just literally have it playing in the background when you're giving yourself that first injection, because it goes by in a step-by-step way, so you can't go wrong. But again, if you did want anything kind of with us, we can do something extra for you as well. Now, once you're administering those injections, there will be 3 different ones you will take, slightly staggered. You're on them for about 2 weeks in total, but we do tell you which one you're taking which day. In that time, you'll come back into your clinic, you'll have a couple of scans. We'll also do another blood test for you in the first few days, just recheck for any sexually transmitted diseases as well. And we do those scans just to make sure you're responding to those injections as we hope you to. A lot of donors do ask about side effects with medication. Most people do report a really positive experience. Some people say they get a bit of redness, a bit of headache. Some people say they get a bit of breast tenderness, like when they're on the period. You might experience a bit of bloating as well. That's quite common because obviously ovaries are filling up with fluids. That's quite normal, really. Again, just to note, we are on hand if you've got any questions about anything when you begin those injections. If anything just doesn't feel quite right, just drop us an email. We can get back to you and give you a call or something like that.
Yeah, and we also have the amazing nursing team as well. So if you've got any worry outside of clinic opening times as well, you can call that emergency number as well. Your donation team will provide that to you, or the nurses will at your scan appointments, injection teachers, or when you pick up your medications. So yeah, they're really supportive, and you should have a member of the team. It should, like, literally a phone call away if you ever need us.
You'll be very by all the team. Yes.
Yeah, definitely. And then does it kind of vary? So during the protocol, when we invite you in scans, it's sort of every couple of days, isn't it, or every other day, and it can vary as to whether you have 2 or 3 before you're ready. And then when you go in for that sort of second or third scan and we say, right, you're ready, what happens then?
So Julie, you want to take this one before I start?
No.
I feel like I'm
Yeah, 1 or 2 scans, and then your scan reviewed, and you're usually given a call later that afternoon to say yes, you're ready for your egg collection, and the time and date is confirmed. And our nursing team will go through things to kind of prepare you for on the day of the egg collection. So you can't drive because you're going to be having medications for the egg collection, which means you can't drive. You need somebody to take you home. No makeup and no perfume, and so they'll go through things like that with you. If you're taking any medications yourself, they'll make sure that it's still okay to take those medications. So you'll be given a call, and then you'll be given a specific time to take that trigger injection. So there's one final injection that you need to take, so it's dead important. So you take note of that time. It's always 36 hours before egg collection.
Yeah.
But I just wanted to touch upon kind of like consent forms before I go on to the egg collection that our donors fill in. So there's various consent forms to say yes, I agree to my eggs being collected and stored, and that those eggs are going to be used for somebody else's treatment. Any embryos that are then created through my eggs, I'm happy for those to be stored, and they're aware that they're for somebody else's treatment. My favourite form that our donors can fill in is the donor information form, and I'm sure some amazing ones, Emily, as well. They either have me in stitches laughing or crying. But it's just interesting for donors to know that initially when somebody wants to try and find a donor to choose, they want to try and match from match with someone who physically resembles them in some way. So we always take your characteristics, your eye colour, your hair, height, ethnic group, and things like that. And this donor information form is what our donors fill in to give some more information about themselves, so their interests, their hobbies, what particularly they're good at, what they might be proud of, whether they did well in school, what job they do, but nothing that could identify them, because it still needs to be anonymous at that point. So it's just there are a few forms to fill in, but again, we'll guide you every step of the way.
Yeah. Oh, this as well, aren't they? Yeah, they're really nice. And the recipients as well. This is good for donors to know that the recipients can read these things about you as well. So it's kind of like selling yourself, I guess, really, isn't it? Because they'll be able to read these things, and and I think that's a really beautiful thing about Care. We don't just match to characteristics. I know that there's a lot of places that just do that, but we kind of take it that one little step further, because we want people to have maybe things in common, or they've got some backgrounds and they go, oh, that's me, that's me. And really nice that then you've kind of got that little bit of a bond with your donor. You don't know them, you might never know them, but you've kind of bonded on that level, and you're creating life, you're creating families together. So it's kind of like you've got that third person there, who's really rooting for you and wanting you to have a baby. So it's nice.
Yeah, no, they are lovely things to read. And I think, to being typically British, we're not very good at selling ourselves, as you said, Chloe. So some of that, when I'm not good at anything, it's like, of course you are. Go and ask your mum how they describe you, ask your husband, ask your best friend. Read some of them that say, my family members would describe me as this. So it's just good for people to know that you write as much information, because it helps them decide if you're the right donor for them.
Yeah, absolutely.
Yeah, and we give you some hints and tips as well. Like Julie said, we'll guide you through it. We send you an information sheet, so we don't literally just send you and leave you to do it on your own. We help you with it, because it's difficult, like you say, selling yourself. It's different for us Brits.
Yeah. We're too modest and we're too polite. We say, don't we? Yeah. Sure. Okay, lovely. So I think we've covered protocol, prescriptions, injections, etc., things like that. So egg collection procedure then, I think, is that the next bit?
Yeah, so most of our clinics do the egg collection under sedation. There are the odd clinic that do it under local anaesthetic, and that can be discussed with your appointment, with your nurse or midwife that you're chatting to. But most it's under sedation. So when you come into clinic, you'll be with us for about 3 to 4 hours. We need to check you in, do your blood pressure and all that kind of assessment. You'll meet the doctor that's doing the procedure, and all the nursing staff, and you'll have your own little room, with it. It's all nice and discreet and very private. The actual procedure itself takes about 15 minutes, and it's done using this ultrasound probe, and you are given some, IV paracetamol, IV fluids, and then some sedation medication and quite a strong pain relief. People do often ask, is it a painful procedure? I can't 100% sit here and say you're not going to feel a thing, but the general feedback is that medication, that sedation medication, gives a bit of a amnesic effect, so people don't really remember. So I'll go and see them on the ward, and they're like, "Oh, has it happened? Has it been and done?" So people just kind of describe it as a bit of discomfort. So it's done using the ultrasound probe, and those ovaries are nicely filled with fluid, and we'll just kind of pierce those follicles and suction that fluid away. As I said, it's mainly a slight discomfort that people tend to describe it as. Most people kind of don't really remember the procedure itself.
No. Yeah, that's generally back.
It's just a case of coming round, making sure you're eating and drinking okay, you're passing urine, you're comfortable. You can take as much time as you need to recover, but you do have to have somebody then to take you home.
Yeah, just
we'll go through it in more detail with you at your appointment. We have some visual aids to try and once you've had your scan, it's easy to then explain the procedure, because you've had the scan, so you kind of know what to expect, and we've got some that help describe the procedure to people.
And I think prior to egg collection, we just sort of say no driving for 24 hours just because of the effects anyway. So you should normally be fine, but nobody really wants to. Afterwards, they kind of feel a bit groggy. They want to go for a bit more of a nap. It feels like you've been for a nap anyway. After a collection is the general feedback, and that it kind of just feels like a bit of period pain. That's kind of what they describe it as. But then, as I say, easily managed by pain medication. We won't discharge until you feel 100% right. The nurses are lovely and they'll look after you. But that's generally the feedback afterwards, that they feel fine. And a lot of people think sedation, or the effects of it, they feel like they've been asleep the whole time, or they've been under. They kind of get it confused as like they feel like they've been under local anaesthetic, because they don't remember a thing. So it's good. They look after you really well. So that's
that sedation medication to having a couple of glasses of prosecco.
Yeah, we just want to reassure everyone that you are in safe hands. You are absolutely fine with us. Yeah. So then I think once the egg collection's done, what happens after that then, guys?
Yeah, so following on from your egg collection, we'll give you a call. We'll send you an email in a couple of weeks after. Obviously, if you need us before, I have had many calls with donors before, so it's up to you really. But yeah, standard, a couple of weeks after, we'll drop you a line really. We just want to kind of check in with you, check how everything went. If you need any further counselling support at that time, obviously you can, fully can access that service. You are paid £750 per donation to cover your expenses. Obviously you've got to get to clinic, fuel prices, crazy as well, and sometimes you've got to take time off work for appointments. That's why we pay that to cover your expenses as well per donation. So we want to ring you, want to make sure you've obviously got that payment, that's all kind of gone smoothly for you. The follow-up call, it really again is just say a massive thank you as well for your generous donation. See if you want to donate again as well. Just get any feedback from you from the procedure as well, because obviously we're always looking to improve from our end as well. So if there's anything you feel like we could do more of or less of, we appreciate a feedback, positive or negative.
Yeah, that is one of the questions that did come in as well earlier that I made a note of. So hopefully the people that were asking about the compensation or the payments, that's answered your question. So yeah, £750 per donation, and that's to cover your expenses or any time off work. So we do advise to have a day off work for the egg collection, just because you probably won't want to go back to work after it's again from the effects and stuff. You might just want to rest and take some time after that. So yeah, that should cover that. Is there anything else we need to sort of go through about the pathway, or do we want to start kicking off with questions? We'll probably do about 10 minutes of questions, and I think that should cover everything.
Yeah,
we've done it in really good time actually. But if anyone's got any questions, I have seen some come through. I have made a note of them. Any that we don't cover, I will talk about other events that we've got coming up that might be more suitable for them just at the end. Okay. But I think the first question was, does donating affect future fertility?
No, is the short answer.
Yeah.
Because every month we kind of lose a number of eggs. So in our natural cycle, one matures, we ovulate, but there's always lots of little eggs there that kind of just don't mature and just get lost away in your period. Yeah. So all we're trying to do is just stimulate those eggs that your body would naturally lose. So we're not stealing your future fertility. I know some people have said, you just take all my eggs. I don't want any more children. You can have them all. We can't take your eggs. We just take eggs that would naturally have been lost in that cycle. So future fertility wise is not affected.
Yeah, that's kind of just an important message to get across, because I know it's a worry for some people.
Yeah.
We obviously take your protocol really seriously, and that's why it's personalised as well for the amount of follicles you've got and the for your donation as well. We obviously want to try and get as many as we can, but we'll do it in a safe way. We're not just high dose stimulation. It's not what it's about. So
no.
Yeah. Is there any risks involved in donating eggs then?
As with anything and everything in life, there is always a small amount of risk involved. The main one really to be aware of is something called OHSS. So this is ovarian hyperstimulation syndrome. This is basically when you overstimulate to the medication that we've given you. To be honest, it doesn't tend to happen with our egg donors as much. Obviously, coming in for several scans, and that is why we do all your initial tests as well, because we want you to be on the correct type of medication. If we have any queries from our end, we always put it to the doctor as well. So again, it doesn't tend to happen with our egg donors. If we thought it was happening, we would reduce your dose as well, and we will give you all this information when you come in for your appointments about OHSS, so you're fully informed of that risk as well. There is a potential risk of infection. It is a minimally invasive theatre procedure. It's single-use sterile equipment. We're not making any incisions, so that's a really, really tiny risk as well. The other risk is having a reaction to the sedation medication. This is a really, really small risk because it is a mild sedation that we're using as well. I know we've been through the side effects with you. The other risk also to be aware of is obviously multiple pregnancy. We are giving this medication, we're getting all your follicles going. So best thing is to avoid intercourse or use a barrier method just to avoid that risk.
Lovely, not a problem. And then someone mentioned earlier, I just saw in the comments, that they're going through donation but they've not got their emergency nurse line. If you want to message me through the page in just a little while, I can get you that for your clinic if anyone needs that, or you can ring the clinic and they'll give that to you. So apologies that you don't have that, but it's really, really easy to get hold of. and you should be fine. And hopefully you have no reason to call the nurses, fingers crossed, which is good. And then, so does it have to be injections in terms of the medication?
Yeah, unfortunately, it it's like, I mean, Emily said before, we can do injection teachers with our videos. If you come into clinic and you was really unsure, we can do injection teachers in the clinic. I did have one lady who was terrified of needles, and actually we cured her fear of needles because she wanted to be a donor so much that she just overcame. It was mutually beneficial.
Yeah.
But yes, it is injections, but they are just the subcutaneous injections in the tummy area. And most people say once they've got over that initial apprehension of doing the first one, they're absolutely fine. Some people's partners, husbands, are really keen to do the injections. You can always ask a mum or a partner or friend who's a student nurse. Again, it's mutually beneficial for them to practice on.
I've heard ice in it, or just before you do it and then pinch, and they are the smallest of needles, so it's literally, it doesn't even go in that far. So just pinch enough and you'll be good. And then I think we mentioned it anyway, just going through the donor pathway. It's just, can I opt out of identifying information? Sorry. I don't think we can.
No, unfortunately not. I mean, that is partly why we offer the counselling service, and we go through the implications in so much detail, just so you are fully informed, and then you can have that counselling, as I said, as much counselling if you want, if you need any support, as well as the implications counselling session, just to make sure you are, fully happy, because unfortunately it's law. So yeah, you can't opt out.
Yeah,
that's the actual partner of the donor that's got more of a concern of that than the donor. Also, sometimes the counselling as for the partner and the donor to attend before we do anything else. And obviously, if they don't want to come through, then that's the end of the journey. That's fine. So yeah.
Yeah, cool, not a problem. That's perfect. And then, how many times can I donate? I think we have covered this.
Yeah, you can donate up to about 5 or 6 times from a medical point of view, but obviously we need to keep an eye on that family limit, so it depends how many eggs we get at your egg collection. But yeah, about 5 or 6 times you can donate, and some of our wonderful donors do that for us.
Lovely. And then there was a bigger one. I know we had quite a few comments on it earlier, so hopefully again they're still here. Do we have a BMI limit for donation?
Under 35, please.
Yes.
That's for your own safety, because you're going to have the egg collection done under sedation, so it's not us being pedantic and what have you. It's for your safety, so that's why that is in place.
Yeah. It's just to minimise risk to you. You're doing an amazing thing. We want to look after you, and the safety is really important, and that does go for any patients coming through, whether it's donation, IVF. It needs to be under 35, because obviously during IVF you'll be the one going through the same injections, egg collection. So yeah, if you're having that treatment, BMI of 35 if you can. And then just one final one that came in. So how many inquiries on average do we get, and do we get a certain like type of donor through more than others?
What I would say is the majority of our donors are white British. And there is a high demand for people from other ethnic minorities. So if anybody's watching this who's perhaps not white British and is thinking of donating but has got some questions, then just get in touch, because there is really a high demand, as I said, for other ethnic minorities. That means that their wait for a donor is really quite a long time. So yeah, ethnic minority donors, we don't really seem to get that through to inquire. So if this has piqued your interest tonight, then just do get in touch, and we can give you as much information as you need.
Yeah, and if you are interested in donating and you don't want to potentially maybe speak to one of us just yet, but you might want to speak to someone who else has been through it, we do have the Care Forum, and we do have a section just for donors. So it is really nice that other donors can kind of chat between each other, chat between themselves, ask any questions, and then that kind of maybe sometimes makes you decide whether you want to go ahead or not. But it's just a nice way to do it without I know some people are nervous to get in touch and don't want to get in touch and go, oh, what if I waste your time? There's not really any of that. We want you to feel informed. There's no pressure whether you say yes or no. But yeah, the forum is a really good way to get in touch with other people, and talk about it that way, and help answer any questions you might have if you don't want to ask them on the live, if you don't want to ask them to us. But you've got that there as well. I think that's covered all of them. This one's a little bit more tough, but again, every donor is individually assessed and everything. But I had one asking, I have PCOS, can I donate?
It just depends on the severity, really, because if you've got PCOS, you're more at risk of overstimulating, which is what Em touched upon before, and you might be more at risk of infection following the egg collection. So it would depend on the severity. So it wouldn't be a categoric no, you know, don't bother applying, but we would just have to review that quite carefully.
Yeah, definitely. If anyone wants to find out a little bit more about the criteria, we do have a really good information page on the website as well, but we do always, just like you say, encourage, send the forms. We can assess them on an individual basis, and we can get back to you with some personal feedback. Like you said before, we might ask extra questions and things like that. It's just to make sure that we've got all the details, and then if we can't unfortunately take you on as a donor, then we can fully explain that to you and that decision. And it's because some people really want to know why, or it is just that little bit easier for them if we can't accept them, but then they know why. So it's just a little bit nicer than saying no.
We'll give you a reason why. We can offer you counselling, you know, if you speak to a counsellor as to why, or you can speak to one of the nursing team as to try and get a fuller explanation.
Yeah. Lovely. Well, I think we've covered everything on the agenda anyway, and all the questions, which is really good. If anyone's got any more, we'll probably stay live for another couple of minutes or so. But if there's anything else that you guys want to touch upon that you think might be important before we sign off, anything we've missed?
Just to be as open and honest really as possible, because there's nothing more upsetting for us, and I'm sure Emily will agree because we've had this before. If you don't put all the information on your forms, and we do go through them with a bit of a fine-tooth comb, they probably think, you've asked me this twice already. Because the reason that what we want to know as much information, our first priority is you. We want to make sure it's safe and appropriate for you to have this treatment. You don't need it for yourself. You're doing it lovely for, you know, for somebody else. But also, so we need to make sure there's no risk to any future children born from your very kind donation. So we need to look at your history and your family history. So if there's something that you forget on the form that you then later tell us, you know, we still have to run that past one of our consultants, and it may change your suitability to donate.
Yeah.
Just be as open as honest, and be as informative as possible when you're filling in your forms and having your chats with us.
Yeah, and it's not us being picky. Again, it's UK wide, so all clinics that do donation have to follow the law and the criteria and everything. And it's just that recipients don't have the same, or it's very unlikely that they're going to have the same genetic background as you or the same family history as you. So it's just to make sure that we're doing the best for the recipients and obviously the donors, and we're able to match them.
Just to make it safe, like I said, that there's no risk to the donor themselves who's doing this greatly for somebody else, and then there's no risk to anybody using those eggs of any conditions that could be passed on.
Yeah. So I think we've covered everything, and it's been really, really good. Hopefully everyone's found it informative. And it's gone 40 minutes, gone really, really quick. So what we'll do is we'll start to sign off, but I know we had some extra questions coming. So if you do want to send us a message directly after the event, please drop us into the inbox and I will get back to you as soon as I can. I know we had some questions on IVF treatment and things like that, but we've got Dr. Tony Rutherford on March the 16th at 6:30 p.m. You can register for that event on our website, and that's going to go through the other side of donations, so those who want to use donor eggs. So he's going to go through all that, and we'll have our events team in the background as well answering questions. But you can submit any of those to us, but sign up for it if you want to attend, and it will be this event, and that event will be posted onto our pages afterwards, so you can view them again if you do miss them. We've also got our virtual information event next week at 6:30 p.m. and again on our website you can register for that, and that's sort of more of the general IVF pathway, support at Care, all the treatments that we offer, and that will be with Professor Kingsland as well. So those are our upcoming events, so hopefully you'll join us for those, and thank you to everyone for joining us tonight, and thanks Emily and Julie for everything.
Thank you,
and a massive thank you again to anybody that signs up after this event. We look forward to speaking to you soon.
Yeah, lovely. Thanks, guys. Well, yeah, I'll let you go and have a lovely evening. Go and get a brew and get your tea.
Thank you.
See you guys soon.
Take care. Bye.
Bye.